Hello, and welcome to another episode of the Heart of Dentistry podcast with our favorite Jamie Marbo Nichols and Brandi Hooker Evans. We are thrilled that you're joining us today, and currently it is the middle end of summer, and we're looking at some major transitions. At this time of year, people have graduated dental school, received their license, and are now entering the workforce, which is a lot of fun and super exciting. And Jamie, would you agree? A little nerve-wracking for all those involved.
Absolutely. I see this time and time again with some of my clients. Yeah. It's nerve-wracking on both ends. And I think what we want to discuss is something as simple as making sure if you are the business owner and you are hiring a new associate to join the practice, how do you get things started off in the right direction so that there's not so many bumps and bruises along the ways for both doctors involved, right? And because you think about it, if it's frustrating for the doctors, you know it's going to be frustrating for the team at times too. So what are some of those headaches, heartaches that we're talking about? It could be as simple as work ethic, and showing up on time, what's expected, those kind of things. And it could be as big as diagnosis being way off, because that can cause a lot of heartache, right? One doctor diagnoses as one way and suggests an MOD, and another one suggests extraction and implants. And then the patient doesn't know what to do because they say, let me think about it. And they come back in 6 months, then maybe see the new associate. And the new associate says, oh, we're just fine with an MOD. So that can cause a lot of big question marks. And then the bigger thing too that happens is that sometimes the hygienist stops teeing things up for the patient for that when the doctor comes in, because he or she doesn't know what the new doctor is going to say or recommend different than the previous owner or the previous or the current owner. So we're going to talk about some of these things, right, Randy?
For sure. It sounds to me like the crux of the issue is clear expectations from the beginning. And in an effort to respect the new graduates' education and the expertise that they have, even coming right out of school, and the seasoned doctor that owns the business is years with the patients and their experience as a licensed clinical profession, I think that there's a lot of conversations that just don't happen with good intent. We don't want to hurt anyone's feelings or rock the boat, but by not sitting down and going play by play for the day, everybody is sitting in a mess that they don't know what to do with. So Jamie, what's step one?
Yeah. And so I just want to clarify, they don't have to be just a new graduate. You could be getting an associate that has, like I have a client right now that acquired a practice and he's had 10 years under his belt, but he's never owned the practice. Or I know some associates that were associates somewhere else, maybe in corporate dentistry for 4 or 5 years, and now they're wanting to get into private practice. So they have years and they have experience too, but it still doesn't matter. I think the first thing to identify is before you even hire, before you even sign on the dotted line, whether you're the business owner or you're the associate coming in, I would just get really clear and have that crucial conversation as to what those expectations are from both parties. Do you, as the new associate, want some mentoring? Do you just jump in the deep end without a life preserver? And if you don't know how to swim, no. You might know dentistry, but you don't know the ins and outs. And I think it's very important that the business owner that is hiring you sits down and lets you know exactly what the culture, what his or her mission statement is, what they're growing to be, and talk to them very openly and ask those questions. But I think mentoring is a big, big deal with this. It's very important.
Yeah, so we cannot skip spending that mentoring moment. And whether the person has been hired already or they're looking at the practice, I believe spending a full day where you are attached at the hip and having the conversations as a regular day so that newcomer can get fully immersed in how things go with you and your teammates. They can
suggest a week.
Oh,
I not just a day because anything could happen one day different than another day. I think that I agree with you with being attached at the hip, but I say shadowing for at least a week and just seeing if it's a good fit, and seeing what they're doing and seeing how they're handling tough situations. Look at how the team responds to this or that,
right.
right?
What's expected during a hygiene exam and what's expected for the setup of an operatory when you're going to do restorative work, all of those things. And I feel like it's important for us to know that you're not asking the new person to come in and clone you and to do everything the way that you're doing it, but
Right.
power. And if you know what the expectations are, then you can have a kind of conversation with the other owner as well as the team about what you would like to bring as your own genius and gift to this situation to add to it rather than I have a better way or I'm lost. I have no idea what their way is, so I can't please anyone.
Uh-huh.
It can really get clear on how things go day to day and then learn what that new person coming in can add to it. Well, now everybody's cooking dinner together and things are looking
Right.
and cheery for the day and the week and the year and the entire partnership of this experience.
Yeah. I can remember I worked for the same doctor in Idaho Falls for like 24 years. And I remember about halfway through our time together, it was time to get an associate. And I think about everything we did wrong. And it was so hard. He said it was like a divorce when he felt like this wasn't going to work out. He felt so bad. But I know that he did not sit down with this new associate slash soon to be partner and go through some of these things we're talking about and look at the time and money it cost my previous doctor to now have to find a new associate and possible future partner. We went through three. And knowing what I know now versus then, I wish so bad that we would have sat down and had clear conversations with those two previous candidates, and associates. I truly believe whether it's a new associate that you're hiring or a new team member, that you need to meet them at their level first. You need to see where they're at so that you can identify with that. And that doesn't mean that you lower your standards. It just meet them at their level so that then they can follow you and show you that leader can show them where it is that they're trying to lead them to. I also believe that what I found with some of my practices is that sometimes associates, they might be a little younger, they might be go-getters, they might be hungry, and their acceptance rate might be pretty high. Their diagnosis level might be higher because the seasoned doctor, business owner, maybe has some emotional baggage with these patients and doesn't want to tell them something they don't want to hear. And this new associate doctor is going, so it could go the opposite way, Brandi, right? I've seen that happen. Right now I'm working with a doctor who's on the practice 10 years. He has two new associate female doctors. And when I go into dental and town and look up their numbers, they're actually out diagnosing him. And it's a good thing to see that too. And rather than him, the business owner being insecure about it, he said, tell me what you do when you go into the operatories. He had a meeting with the hygienist. He said, tell me what Dr. A does differently than what I do, or Dr. B does differently than I do when I come in and do your exams. And it was a really great, healthy conversation. So it could go both ways eventually.
Oh, no doubt about it. And I believe that is the crux of the issue anytime you're adding someone new. If you can honor and value both the new to the practice, whether they're new to dentistry or not, but the newness, the freshness, the excitement, the vigor, the no preconceived notions, the no tainted, corrupted, bad days that go along with it, as well as that seasoned dentist that's opened 10,000, 20,000, 30,000 teeth and knows when to diagnose of filling or a crown based on what the inside of the teeth is going to look like after.
Yeah.
So if we can honor the new and the old, that's where the sweet spot is. That's where the passion can come back, because that experienced doctor is now getting something from an unexpected source or maybe expected source that is going to improve their delight in doing exams. It's going to give them another tool to make them feel that they are even better than they were before. And that's brilliant and wonderful and such a positive benefit for that doctor that already had the practice going. And
Yeah.
likewise, it's beautiful and exciting for that new doctor to feel like they are seen and heard and valued. And you know what? They don't know everything yet, but dang it, they have something to add.
Yes. There's a lot of value to that. And I think about you and I even, I graduated from dental hygiene school back in the 80s. And even though I'm been consulting for quite a few years now, over a decade, I think that there's things that you have taught me, being newer out of hygiene school. And there's pros and cons to both, and we have difference of opinions on certain things. But in general, we just want to offer, just like these dentists do, offer the very best care that they can to their patients, like we do to our listeners. We want to help our listeners. So what are our takeaways here? What are the tools that they can use? I would say my first one, then you say yours. My first one is to make sure that if you are the existing owner, that you sit down with your new doctors, and you talk about your mission statement and your vision and what your goals are and the expectations that you would like to see happen for you and for them. What is your takeaway? What is your piece of advice?
Well, I do want to add, Jamie, when you and I are together, I feel like I'm learning from the best. So thank you for being my mentor. I do appreciate that.
Oh, you're welcome.
And mine is to piggyback on yours. Once you sit down and have those conversations, the talk is beautiful, but let's see the rubber meet the road. Let's get the new dentist and the old dentist attached to the hip.
Dentist. I'm joking.
The poor old one. Sorry, this season. I've actually graduated to becoming a seasoned hygienist now, and every time I hear that, I'm like, I think it makes me just as sweaty as the elf does. But either way, so the newbie and the oldie will just roll and attach at the hip for a day, a week, a month, whatever you feel like it needs to be, blessing one another with the experience as well as the new perspective.
Yeah.
And I think Jamie, we together believe that if you can start with the open conversation, start attached at the hip, you're jumping off of a springboard. It is going to go well from there. And all that can work itself out if we can just get that first part right.
Yes, all parties involved, the doctors, the team members, and the patients. It'll all be a win-win. It doesn't mean you have to see eye to eye on everything, but when you don't, you have those conversations. Or when you're unclear, you have those conversations. You don't wait and worry. This is the part where you have to rip off the Band-Aid and worry about upsetting someone. My grandma used to always say, you can say anything you want to anyone. It's just how you say it. So there's always that opportunity to talk, as long as it comes from a place of love and respect. So it's okay to say, let's get a treatment plan out. Let's look at these x-rays of these images. Let's sit down and see what I would have treatment plan and then what you would have treatment plan. And then come together in front of the team and say, hey, this is where we differ, but this is what you're going to expect. So if new doctor is coming in to do the exam, you can still tee it up because he or she is going to do this, this, and this with this situation. So I think that getting some treatment plans out, talking about, do a blind exam, so to speak, and see where you match and where you differ, and then talk about it. Do not be afraid to talk about your clinical philosophies that might not be exactly the same.
Discomfort in the moment is peace in the long run. So
exactly.
We're going to send you guys off with that note. Thank you so much for joining us on the Heart of Dentistry, where we are taking the ache out and putting the heart back in.
Yay. Make it a great day.